My name's Steve Pardue. I'm one of the managing members of Elevate Oral Care. We're a preventive care company that prides ourselves not on only providing great preventive care products, but also on teaching offices and helping offices communicate that to patients and making them part of that treatment program. In order to do that, we brought in an expert, Dr. Matt Allen, who's not only a dentist, he's also a member of the Motivational Interviewing Network. And he's here to help us walk through how to do that type of communication with patients and how to better motivate patients to be part of their treatment plans. Can you give us a view of what that would entail?
Yeah, so, with this video series, what we're really hoping to do is to, prevention is a relative, it's not a new concept for dentistry, but it's something that we haven't often focused on. In dental school, people aren't telling you how to communicate with patients about, hey, prevention. It's just tell patients what to do. And that's kind of been the historic model for this. And so what we want to do is to help shift that conversation, help offices understand what might it look like to actually involve the patient in that conversation? What might it look like to help a patient say, I want to do this. I want to be brushing my teeth more, or I want to be doing X, Y, or Z. So that's really our hope is to help offices better understand how to do this, help dentists, hygienists, whoever it might be. And when we look through what patients actually want, they want providers who listen to them, who hear them, who value them, who speak to them with compassion and non-judgment. So I think a lot of that goes to what we're trying to do here in this video series.
That makes a lot of sense. So it's part of many of these prevention things that can be done are things that the patients can do themselves at home. Mm-hmm. So it's not just the treatments in the office that we can provide as the experts, but it's also the treatments that they can do and when they do their oral hygiene habits.
Totally.
So it's making them part of the process. It's also helping them choose what gets done in the office with you, with your guidance, of course.
Yeah, there's really two experts in the room, right? Like we are experts in oral health and some of what that means, but the patient is an expert in themselves. And how do we loop them in? How do we help them be the one that's the voice for change? And how do we understand what their hopes, their goals, their desires for their oral health are? I've never met a patient ever who said, you know what, I want teeth that hurt, that look bad, right? So how do we help loop the patient into that conversation, make them not just part of that conversation, but the center of that conversation. Each individual patient hearing their individual unique desires, hopes, goals, things like that we can really work towards and help them achieve oral health.
Very good. So as our offices begin to use this type of interviewing and discussions with patients, what are some of the skills that they might need to use?
Yeah, so, motivational interviewing is this concept that was born from addiction therapy that has then since moved to medical care and is now coming to dental care as well. We understand that it's managing chronic disease. Caries is a chronic disease, right? And so how do we help manage that? And a lot of that is helping patients change behaviors. One of the things that I think is also very helpful in terms of doing this in office is sharing decision-making. And there's this concept of shared decision-making that really helps patients have a voice, understand their options, understand risks, benefits, alternatives, really gives them power. And again, we want to help patients take control of their own oral health. That's an important concept. And so those two things together can really help us hear from patients, help us respect their autonomy. No one wants to be told what to do, right? I have a friend who calls his semi-annual office visit his semi-annual scolding. And I hope that we can change that. I hope that we can help patients come in and feel like, wow, my dentist heard me, my hygienist heard me, my assistant heard me, whoever in the office really hears me, understands me, knows me.
Very good. Well, we're hoping that the videos that we're assembling here can help offices move into this type of communication with their patients. So we're looking forward to some of the examples that we're going to be putting together today.
Awesome. Thanks for having me here. I appreciate it.
Thank you for coming and helping.
Yeah.